So I have Angela here with me today. She's going to be my little patient. This is my health history interview with her. So this would be, I greeted her in the lobby already. She's filled out the health history form. I've got it back. I've taken it to the office or to the room, and I've circled all her yeses in red, and I've reviewed them. I looked up some of the prescriptions that she said she was taking, so I know what questions to ask her. And at this point, we're back in the room so we can be alone to do our interview. And so we're just gonna go cut from there in this video. Okay. So the first one that I noted down was that she said that she wasn't experiencing any dental discomfort overall. Okay, I'm gonna actually be more like I'm talking to you, okay?
Okay.
That's how we're gonna do this. So you said you weren't experiencing any overall dental discomfort, but you said yes to having a popping in the right side of your jaw. So is that painful?
Yes.
Can you show me where? Okay.
Towards the back.
Okay. And how long has that been bothering you?
It started a few years ago, but it just recently started hurting a little more. So.
Okay. Well, I'll make sure to examine that when we do the extra oral examination. I may suggest to the dentist prescribing a Panorex, and we will just go from there. So I noted down that the last date of her exam was October 2019, 8 months ago, so not too long ago. It seems like she has a good dental history of coming to visits, and her last x-rays were the visit before that, February 2019, so that's about 16 months ago. So if we didn't do the x-ray to view probably the TMJ joint this visit, then she'd probably be due for her x-rays next visit. But continuing, as I went down, the first thing I saw was that she put yes for being hospitalized in the last 5 years. So can you tell me about that? What were you hospitalized for?
I was hospitalized because I found out I had type 2 diabetes.
Okay.
And I lost like 50 pounds in a very short amount of time. So
Okay.
rapid weight loss.
And you were prescribed to metformin. How many, or when do you take that? How often?
I take it every morning, 850 milligrams.
Okay, and did you take it this morning?
Mm-hmm.
And has it been under control since that?
Yeah,
or?
ever since I was prescribed, I never had any problems with it. It's worked really well ever since.
Okay. I did see that you put yes for fainting or seizures. Do you have frequent seizures? Is that?
No seizures, just I get lightheaded sometimes, close to feeling lightheaded because, you know, the medicine wears off at the end of the day. So.
Yeah. So before this, hopefully this would be something that would be discussed over the phone, and I most likely want to do her appointment then in the morning, because if she takes her medicine in the morning, it'd be better for her, especially, you know, patients experience anxiety coming in sometimes to the dental office. It'd just be better to know this kind of information through maybe a telephone interview or something that I know we learned about this semester and last semester, maybe a little bit. But anyways, continuing, so then another yes that was on the health history form was that you had rapid weight loss, which you mentioned that, and has it been stable since then? Has your weight been stable? Okay. Okay, well that looks about all that I saw on her history form. So I would make sure that we both sign it and that we date it, and that I record all her information into the system and into her file and her dental record, and we would go into the next step of the day. Okay.